Sometimes you're called down to the emergency room and they do a sonogram of the girl's ovaries and they say one of them is twisted. How can an ovary twist?
You know, somebody in about 1920 said that it came from cranking an automobile. Well, we don't crank our automobiles anymore, so I guess that's not the only answer. People said it came from gymnastics, from a little kid doing somersaults. It probably has to do with a certain looseness, that some ovaries just aren't as attached to the ligaments as others. But it is true that an ovary is suspended on the fallopian tube. You know, inside a girl, she's got a uterus and a fallopian tube hanging like branches from a tree, one on each side, at the tips of which are ovaries. And if that ovary twists on the fallopian tube, it gets choked, loses its blood supply, and that's a real emergency.
And if you did surgery, do you have to open up the whole belly, or do you go down with a little scope?
Yeah, so the skilled pediatric surgeon today, modern approach is to use minimally invasive approaches, tiny little trocar incisions, and you can untwist that ovary. And even if you have to remove it, even if you decide to remove it, it can be done with very small incisions in many cases.
Sometimes they see fluid, a big fluid sac around the ovary, and that isn't surgery. That's just women becoming women because they get sometimes a gluteal cyst.
Well, it's very interesting because during the reproductive years, when girls are releasing eggs from age 10, 11 to age 50, little cysts form as part of the normal fertility processes as eggs are released in the middle of the menstrual cycle and making the woman fertile. But amazingly, that starts in utero. Little ovaries in utero are stimulated by hormones, and nowadays we see patients who aren't yet born because there are cysts on their ovaries. Little clear cysts. That's normal physiology, and if left alone, will usually just resolve and be fine.
But the trick is it's fluid in a sac from the ovary.
Yes.
And that's always benign,
Yes,
is that correct?
yes, it's always benign in the little tiny baby, and occasionally that can cause a twisting of the ovary. So it has to be looked at carefully by a good sonographer and a good pediatric surgeon with some familiarity.
If there's something on the ovary that isn't fluid and enlarging, that isn't such a good thing to hear. Is that true?
Well, cancer of the ovary in the first months and weeks of life is essentially unheard of. But an older child, if there's something more solid growing, it can be a tumor. The most common tumor we see in a girl's ovary is benign. It needs to come out, but it's benign. It's called a teratoma. There are cancers. Fortunately, this terrible adenocarcinoma of the ovary that is such a threat to women is rare in children, fortunately. But like most things in pediatrics, children make different kinds of cancers, oftentimes more treatable than the adult variations, and they still need attention.